I want to bring in Dr. Theodore Strange now. He is the Interim Chair of Medicine at Staten Island University Hospital. Dr. Strange, welcome. Great to have you with us. So the borough of Staten Island is a COVID hotspot. What are you seeing in your hospital in terms of the number and severity of COVID cases?
Yeah, Staten Island has become a little epicenter out here in the second wave. We have 195 or so patients currently in our hospital. We're averaging about 20% of our admissions, and the community is seeing about a 6% positivity rate here on Staten Island right now.
And then we are predicting, I guess, our health officials are predicting a surge, a sort of post-Thanksgiving surge. How much more capacity does your hospital have left for new COVID cases?
So we've opened up a satellite hospital next to us, or a field hospital, and we are going to be housing, or we currently have about 34 patients there with COVID disease that are less severity but still require hospitalization. We plan to ramp that up to probably close to 50, 55 next week, and can double that capacity if we need to in the following weeks with staffing. So we're looking to take care of every Staten Islander that needs to be taken care of, both for their COVID disease and for whatever else they need to present with. We have a secondary hospital about 8 miles south of that. That is a COVID-contained environment where there's currently no patients with COVID disease there, and we're taking care of the heart attacks, the pneumonias, the other things that the community needs care for. So we are trying to take care of all the patients that need care on Staten Island.
You sound like you are very prepared. Medical services still are being stretched to their limits with the vaccine. Yes. Possibly getting approved in a matter of days. You know, does your hospital have the infrastructure it needs to vaccinate a large amount of people quickly?
Sure. So there's a process being put in place by our parent organization, Northwell Health, and with us. And although I don't have the details of that process, I'm confident that we will have the ability and the place and the services necessary to vaccinate all the first people who require the vaccine, and move that quickly out into the community as we need to over the course of the next months. Staten Island is a resilient community. Staten Island University Hospital is here for our community under our executive leadership with Dr. Brahim Ardolik and the Northwell leadership. We're confident that we will be able to do what's necessary to vaccinate and to take care of all the people here on Staten Island.
Sounds like you definitely have a great plan, Doctor. Staten Island, in terms of all of New York, is much more conservative politically than the other boroughs. And unfortunately, we have seen this virus become politicized. And there are some residents, who are resisting some of the COVID restrictions and guidelines. Are you concerned that local leaders may continue to politicize perhaps the vaccine for residents there? And if so, are there any plans in the works to ensure citizens the vaccine is safe?
So I think what you're doing here today, and what some of the other local press is doing, is just paramount to apoliticizing this whole thing. This is not a political virus. This is not a political time. Again, let's go back to the three main W's, wearing your mask, watching your distance 6 feet away, washing your hands in every way you can do this. That's not political. That's real. We do know that businesses have suffered, and we feel bad for the businesses out there, and we want to get people back to work. But if we do that in the right way, by wearing your mask, washing your hands, watching your distance, we should be able to accomplish this. The light is at the end of the tunnel here. We have therapeutics now that are able to help treat some of these patients. As you just showed in your previous clip, we have vaccines that are going to be available within days and weeks. And by hopefully the middle of 21, vaccinating a large amount of our community and society. Let's not do the wrong things now, which is common sense. The science clearly has spoken to doing the right thing. And even doing that, if we wore our masks properly, we can go back into some of the businesses. But doing the wrong thing about not wearing the mask, not socially distancing, is not only hurting yourself, it's hurting your family, it's hurting your neighbors, it's hurting all the good things that we have been fighting for the last 8 months. Why do we want to go backwards? We have the opportunity now, and there's a light here. Let's take that on, and let's take that on with full force. Let's wear these masks every day. Let's wash our hands. I keep going back to that, and let's watch our distance. We do that, 21 will be a better year.
Great advice, basic steps we can all take. Dr. Theodore Strange, thank you so much for joining us.
Thank you. Happy holidays to all. And just everybody be safe out there and follow those 3 W's.